Thank you, Julie, for coming in.
Of course. Thank you for
it.
having me.
Yeah, so really want to talk about your journey and everything you've been through. And so how long ago did you start to have symptoms?
My symptoms first started when I was 13 years old, so even before my first cycle, actually, they started.
Okay, and what did you start to feel?
Strange cramping feeling, pressure, sharp pains, and my pediatrician, they sent me to gastroenterologist, and they just thought it was IBS at that point because I never started my cycle yet.
I see.
Yes.
Okay. And at the time, were you able to go to school or participate in sports when you were feeling those symptoms?
When I was playing soccer, and I did miss about like a month of school during trying to figure out what was going on. And then it kind of eased off a little bit.
Okay.
And then I got my cycle when I was 14. So,
Okay.
and it was always really pretty bad from the get-go. Yeah, I would have to miss school for like 3 days, use the heating pad and everything.
Wow, okay.
Yes.
All right. And similar symptoms with the cramping in your abdomen?
Yes.
Yes, okay.
Yeah.
Did it move anywhere? Did it go to your back or hips or buttocks or down your legs or?
No, it was pretty much just in this
Lower
area,
abdomen.
the lower abdomen.
Okay.
And then when I was 15, I like dropped to the floor because I had a grapefruit-sized cyst, I found out.
Right.
So, and that's when everything kind of started, when I went to my first gynecologist appointment, and
I see.
during that surgery for this cyst, they questioned endometriosis.
I see.
And that was the first time I ever heard about it or anything, so.
Okay,
Yes.
got it. And anything else after your surgery for your cyst? Anything that was done or what?
Birth control pills.
Birth control pill?
Yep.
And did that help you?
They put me on a bunch of different things because I was getting sick from it, the patch, I would throw up and everything like that. So they tried all different things. They tried the NuvaRing, but I was way too young for that.
Right.
Couldn't manage that yet.
Tough, right.
Yes.
Okay.
And then when I started feeling the period cramping without my period, I started going to specialists.
Okay, got it. So at first it was coming only with your period for a couple years.
Yes.
And then it started to come more often.
Yes. Once I had that like strange pain, it was probably starting when I was 13.
Right, right.
And then it kind of leveled out. And then when I got my cycle, it was just during my cycle, which was like horrible, and ovulation was really terrible for me as well.
Okay.
So then I had the cyst surgery, and then everything kind of spiraled from there.
From there.
Yes.
Okay.
I believe I had my first endometriosis excision when I was 15.
I see. And did that, and then afterwards, and then you felt better, and then for a bit, or?
No.
Okay, so
Yeah.
it took some time.
Yes.
Okay.
It's tough
Yeah,
with the
it's a challenge.
surgeries and everything.
It
So I
is.
was in and out of school all throughout high school.
Throughout high school, okay.
So I would do home tutoring, like through the school. They would send teachers to my house and everything.
Okay.
So I would try to do some of the year, and it was a lot of surgeries back and forth.
Okay, all
Yeah.
right. So junior and senior year?
Yes.
Sophomore, junior, and senior?
Yes.
Okay.
Yeah.
All right. That's hard. That's challenging.
Yeah, it definitely was. And you don't really, at that age, you're not understanding what's going on. You just want to feel better.
Feel better, right.
I wanted to play soccer and just enjoy my time with my friends and everything. So
Okay.
it can be challenging for sure.
Okay. And during that time, did you have any symptoms where certain foods would make it feel worse? Any?
I remember they tried me on all different types of diets, even before when I saw the gastroenterologist, so like a low acid diet and everything like that.
Okay.
But I wasn't really cognizant of different foods then or anything. I think I was just too young.
Right, at that
Yeah.
point. Right, you were so young.
Yeah.
And did you feel some bloating with the pain?
Oh my goodness, yes.
A lot of bloating,
Yes.
Okay.
I would look pregnant.
You felt like you looked pregnant
Yes.
with the bloating, okay.
Yes.
And any constipation with it?
Probably from different medications they put me on, yes.
Okay, and any urinary urgency with that?
Yes.
Okay.
Yep.
Got it.
A lot of urinary problems as well. I feel like that's all mixed in.
Okay.
with
Yes,
it.
definitely is.
Yeah.
Yes. And during certain times of the day, did it feel different, or was it more within certain times of the month? when you woke up in the morning or at night? Was there anything that made it feel worse? Activity?
Usually at night was my time. Now it's changed as I've gotten older, but at nighttime it was the worst.
It was the worst time.
Yes.
Okay.
Yes.
Got it.
So.
And were you able to participate socially? Would go out with friends to the movies or?
Sometimes here and there, but not as much as I would have liked. My friends were really good about coming to my house, and I would be in the bathtub like crying, and they would sit in there with me and just try and make me laugh and hold my hand, and they were really supportive. Or they just, lay in bed with me while I used my heating pad, and they were right there with me through it all. So
Okay.
yeah.
So it sounds like heat and warm baths are what made you feel better.
Yes, and a good episode of Buffy.
Okay, and then how many surgeries did you have in total?
Total, so I'm 27 now. I've had 12 surgeries.
12.
Yes.
Okay.
And my last surgery was in 2015.
Okay.
Yes.
Okay.
And I had, when I was 17, I was breaching out because none of the surgeries were working. It's very hard, as we know.
Correct. Challenge. Very
to
hard.
Find the right excision specialist, and even then it's not a guarantee. And I went to Atlanta to a specialist, and they did one surgery when I was 16, and then I went back because it didn't help, and when I was 17 they did a partial hysterectomy.
Okay.
Yes.
Okay.
And that helped.
And that helped you.
Yes, and I was able to then graduate. I was able to go to college, but that lasted for about a year.
Per year.
Yes.
Okay, got it.
And that's when I think after that surgery, I started realizing more different pains.
What pains came then after?
Inside
internal, yeah.
Internal pain. So, and I didn't know anything about pelvic floor physical therapy or anything like that. I feel like that was around 2009.
I see. And that was your first time you had tried pelvic floor physical therapy?
No, I just didn't know about it.
It wasn't an option. Yeah. You didn't hear about it.
Yeah, no.
Right. And when did you first hear about pelvic floor physical therapy?
I heard about it in 2014.
2014.
Yes,
Okay.
I just left law school. I had to take a medical leave because the pain was just too bad. And I knew I needed another surgery, and that was the first time someone brought it up to me, and I started looking into it.
Okay, great.
Yeah.
And so you tried it then? And
Yes.
That's great. And
Everything together helps, for sure. You can't just have surgery and expect amazing results.
Right. I
So.
see. It's the entire package.
Yeah.
A couple of questions. Do you ever have a history of pain with tampon use? Do you remember? Did that ever
Yes.
bother you?
Yes.
Yeah, that's a classic.
Yes.
Yes. Okay.
It was very difficult to
do.
Yeah.
You could unable to do it.
Yes.
I see. Okay.
I did, but
It was not comfortable at all.
Yeah.
Okay. And what about any discomfort with any gynecological speculum exams or transvaginal ultrasounds? Patients say hurt them.
Yes, I was 14 for my first one. So yeah,
and
it was very painful.
Very painful.
Yes.
Okay.
And anytime I had to go, I was dreading it.
Okay.
So,
Okay.
yeah.
Got it. Yeah. Okay. And then with the pelvic floor physical therapy, what else have you done? Have you done any stretching or yoga with it? Or?
some yoga DVDs that center around endometriosis.
Great.
I always should be doing more. I feel like walking. I can go hiking up where I live.
Great.
So yeah.
Great. And medication-wise, through the history of your pelvic pain,
Yeah.
can we go through that? What did you first start off with in terms of medications, and at what age were you?
Ooh, might be hard to remember. I know I did a round of Lupron shots when I was 16. It was after my first endometriosis surgery.
Okay. So the hormonal.
Yes, so I was in menopause, like at school, having hot flashes when I was like 16 years old, so 15 or 16.
Okay.
So, yeah, that was interesting. And I've been on birth control ever since I was diagnosed.
Ever since?
Yes.
Okay.
And different ones. I was on low Seasonic for a while, Seasonic. Now I'm on low Overall.
Okay.
So that seems to help.
Good. Okay.
Yeah.
Great. So you've been through the hormonal medications.
Yes.
And what about any other medications in terms of for pain? Have you tried any of the non-steroidal anti-inflammatories? Do you
Yes.
ibuprofens, or at what age did you require those?
When I was 14.
Starting at 14.
Yeah.
Okay, so started with ibuprofen?
Yes. Yeah.
Okay, yep. And then
Yeah.
and then when that wasn't enough, you've gone through multiple
Yes, for
medications?
sure. Yeah.
Okay, yep.
Yeah, all different types. A lot of them would make you too sick and everything like that, so it's really difficult. But the vaginal Valium has been very helpful.
Good.
Yes.
Yes. That's great. The muscle relaxer of
Yes,
those
that
pelvic
goes
floor
straight
muscles.
to the muscles. It doesn't
Yes.
affect your mind or anything, and
That's great.
so yeah,
That's
it helps
perfect.
calm everything down for sure.
Good.
And then injections, that with pelvic floor physical therapy, the injections and seeing a specialist, all works perfectly.
Good.
Yeah.
And what about, have you tried any meditation? Tried any breathing or meditation? Or
I have, yes, a
sometimes-
little bit. I don't do it every day.
It's
I
hard,
should,
right?
I know. But I've read a few books on it, and I used to, when I was in the really bad flare when I left law school, I was trying everything.
Everything.
So I was like doing whatever I could.
Great, great. And how about nutrition? Have you found anything in nutrition that helps you? Or
Yes,
anything?
being gluten-free
Gluten-free.
really helps, yes.
Yes.
And you'll notice like a significant difference. So gluten-free, try to stay away from coffee, but I used to drink a lot more coffee, but now I'll have like 1 cup.
Does it bother your bladder?
Yes.
The coffee? That's what we, yes.
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 Yeah.
Okay.
Seems to flame it up a bit. And soda, like any carbonation
Can
bother-
irritate.
Yeah.
Okay.
Yeah.
Yeah, so the gluten-free has helped you a lot.
Yes, and I stay away
Great.
from acidic juices and things like that.
Okay,
No
so
iced tea, no lemonade, no orange juice.
So almost the interstitial cystitis diet.
Probably.
That combination's great.
Yeah.
Good. Okay.
Yeah.
Good. Now, what would be one thing that you wish that at age 13 or 14 that you had known and you would kind of like other patients to know who are maybe going through something similar to what you went through?
There's a lot. That's a good question. That it's complicated and there can never be a miracle surgery, and I feel like we all just think maybe this surgery will be the one, and that gets stuck in your mind. So I think that you have to realize that you can't just see a specialist. You also need to integrate all these other types of therapy into your life in order to feel better and fix every area that needs to be fixed.
Right.
So,
Right.
yeah.
And
And just that it'll get better.
it'll get better.
Yes.
Yeah.
And there's going to be times where I do feel good, and there's going to be times where I don't feel good.
and understanding
Yes.
that. Yes.
Mhm.
And what would be something to the medical practitioners and researchers out there for pelvic pain and endometriosis? What would be something that you would hope for or hope that they would concentrate on? Is there anything that you would, if you could ask them, that you would ask them to focus on?
I feel like it's a devastating disease, so I just ask them to try and do everything they can. I know and get the conversation going, but also be real with your patients,
Right.
Tell them, it's not going to be a guarantee that you're going to feel better, and just give them all the options. Like, I never had all the information. Now that I'm older, I'm learning more, and I think the conversation is growing about endometriosis and all the
Yes.
different types of pelvic disorders, but the fact that I should have had pelvic physical therapy right after my hysterectomy, and I've never been told about it. So I think just everyone coming together and informing their patients, or even I wish that maybe I was directed to different doctors too, if it wasn't working with one, if they could give me a referral, just to
Right.
help.
Mhm.
So
Definitely.
maybe, and definitely if we can find a medication or some type of cure.
Right.
That's the ideal
That's the
thing.
ideal.
Instead of just, no one else is going through 12 surgeries and a hysterectomy at 17. It's still crazy to me
Right.
that I even have to say that.
Right. Right. No,
So
you're right. And what would be some ideas to help us in the medical field raise patient awareness? Any other ideas you would have, or any comments on that? Because awareness is the key.
No,
and
it
is
is
empowering for the patients to kind of
Yes.
understand and have more knowledge about what's going on.
Yes, I think getting patients more involved. I think your practice that's just centered around pelvic pain is perfect. I feel like that's not out there a lot. So I think getting patients involved in creating these events and what they would like to get out of it and what they would like to hear and the different techniques or therapies that are out there. So I think that's really important to get patients involved in it, and maybe even get the doctors together more, kind of brainstorm maybe. So if they have connections, you could refer a patient, oh, I know this person, and you can go here. So just different options, I think would be the best, I would hope.
So how are you doing nowadays?
I'm doing great. Yes.
Perfect.
Because
so
of
do you have some flare-ups once in a while? And if you do flare, how do you deal with those flare-ups?
So I do tend to have flare-ups still. I still have one ovary left, so I can ovulate. And if I just overexert myself, if I lift something or different activities, you never know. So I will take a bath, take showers, use my heating pad. I try to take it easy, but also I noticed getting myself out and texting a friend and going out for a walk will help too. So even if I don't want to be active, I still try to get myself out there, because after I do feel a little bit better.
Right. With activity, you have increased blood flow, and that's a lot of times will help with pain and discomfort.
Yes. So
particularly low impact activity, such as a walk or getting in the water, a swim, or even a warm bath. But the idea is some heat and then some blood flow is a nice combination.
Even ice packs too,
ice,
from time to time.
Definitely. So the ice will help decrease inflammation. So it's almost like taking a couple Advil. And then the heat will help relax the muscles. So it's almost like taking a muscle relaxer. So it's a nice natural way to decrease inflammation and relax the muscles without medication. I usually say to start with the ice for 10 to 15 minutes and then follow it with a nice heat for another 10 to 15 minutes.
Gotcha. Yeah, that seems to help a lot. I feel like most people use heat. It's just a given. I think you know that with endo patients.
The heating is big.
And I burnt my stomach when I was younger, so.
Seen that quite often, the burn marks. But you can combine them. You can do both. It's okay.
A happy medium. And, there will be a day where you just have to, say, okay, I can lay in bed today and take it easy, and it was just too much. So, and then I'll use the vaginal suppository. That'll help.
Vaginal suppositories. Okay. And do you find sometimes doing either stretching or yoga or some of your physical therapy home program helps you too?
Yep, I'll do simple, I don't know the pose, but where you just have your legs laid flat.
Yes. With open and laid flat.
Yes. Yeah,
that's
and then
a great
I'll
one.
put pressure just because it feels better. I'll have my cat lay on me or something.
You put some pressure on it.
Yes.
Yeah, the pressure does help. It almost distracts your nerves.
Yeah.
That's what the pressure is doing. So it
Oh,
distracts
really?
the pain, the nerves that cause pain. So it's a distraction, and so you're feeling a different sensation going up into the spinal cord and brain, and it makes you feel better.
I always wondered. I know. I would put one of my law school textbooks on my stomach, and I never knew why, but I was like, it feels better.
Yeah, it's a different sort of sensation. So it's crowding the signals, which is a good thing.
Oh, okay. Cool.
Yeah.
Learning something new.
And have you ever tried a TENS unit ever at home, a home TENS unit?
Not at home. At physical therapy, they've tried it. Yes.
Does it help a bit, or?
That was when I needed surgery, so I didn't
it's always
really.
a challenge.
Yeah, so I couldn't tell.
Right.
Yeah.
Okay.
So I think they didn't put it directly on my stomach. They would put it in
posterior in your back area.
Yes.
Buttocks. Yeah.
Yes.
Got it. Okay.
And I think I even went before my surgery, a trial to put the TENS unit in your back, but that didn't help.
That didn't help.
No.
Yes. So that was called neuromodulation, right?
Okay.
Sometimes they can, again, it's like a TENS unit, but they leave it inside you, and it can help modulate the nerves that cause pain, similar to concepts of the textbook, but it didn't help you.
No.
Okay.
Yeah, which was, you feel it all throughout your legs and everything, but no, it didn't help. So, And I've talked to a few other people that have tried it and it hasn't helped them either. So I don't really think that's the answer, like permanently, because once you put it in, you can't take it out.
Right. So you're feeling great, and you're, what are your plans for school and work?
So I'm feeling really good right now. I'm doing the best that I've been in the last 3 years. So I feel like I'm getting parts of my life back that I really missed.
Great.
I plan on going to school for acupuncture. So hopefully I can help out patients with pelvic pain and give back a little bit. So
amazing.
Hopefully it'll work out.
Well, you're doing so well now for the past couple of years, 2.5 to 3 years, which is amazing. What do you think was the turning point of really starting to turn the corner and function and go to social functions, go to work, and really live a higher quality of life?
Definitely, I'm doing so much better. I think the turning point was when I was referred to you by a mutual friend. I met you at the Blossom Ball.
Oh, right. That's when we first met.
And my friend Kelly was seeing you, and so when I went to see you, that was the best decision I ever made. And from there, it took I was doing 2 injections a month for I think about a year. And it does take time, but when you stick with it, now I'm doing amazing. I could never see even as the months go on, I'm still doing better.
That's great.
Yeah.
Great. And you combine the injections with the pelvic floor physical therapy.
Yes, with pelvic floor physical therapy and the nutrition. And you just really listen to your body. And if you do flare, try not to freak out. And, because sometimes you're like, uh-oh, I'm having these symptoms again. What do I do? But to listen to your body, I take notes as well.
Smart.
Yes, to see a pattern or anything. And I try to catch it early in your office. And see what I have to do to take care of it. It's a lot about self-care and really listening to your body.
Great.
Yes.
And now, do you feel the different sensations with a flare-up versus when you feel you may need another excision surgery? Does it feel different to you?
It does feel different, yes.
To decipher?
I think I can decipher. So when I need a surgery, it's intense pain constantly, all the time. And it's a different type of pain. It's not pelvic floor pain. So after the surgery and going through my surgery in 2015, and then starting to see pelvic floor physical therapists and then doing the injections, you really start to know the different parts more, if that makes sense. You're more aware of the different pains, and it does feel differently. So it's just more intense, and I will know if I need a surgery or not.
Right, nothing's relieving it.
Yes.
Right.
Yes.
You take your warm bath, you go for your walk, you see the physical therapist, you see me.
Right.
Try a Valium suppository and really monitor your diet, but you still have severe sharp pain.
Exactly.
Yeah. Okay.
And you're not able to function.
And even sleep, does it help? Does it stop you from sleeping as well when it's that bad?
Yes.
Yes. Okay. Right.
Pretty much everything.
Right.
Yeah.
Okay. Got it.
So I used to take a lot of Advil PM.
Yes, to help sleep. Yeah, I've heard that very often.
Yeah.
Okay.
Try and, it helps with the pain and it makes you fall asleep, so you can just get some sense of sleep. But I was still waking up and probably taking 8 baths in a day.
Okay.
And that's when it's time for surgery. Yes.
Okay.
Yes.
Yeah, a lot of it really is understanding your body and having a great team of specialists like you do with the pelvic floor physical therapy and the knowledge of nutrition and exercise. It's a lot of it is education and knowledge that it's great that you have and are taking care of yourself. It's so important.
Yeah, it really is. You have to listen to yourself and listen to your doctors. And I'm just lucky that I have all the specialists and doctors that I have. So I'm happy.
Well, Julie, thank you so much for coming in. Really, really appreciate you sharing your story and helping others who may be going through this understand that they're not alone and there is help out there and there is support from patients like you.
Thank you for having me. Yes, I want everyone to know there is hope and not to give up, and there is so much support out there, and to just really listen to yourself and things will get better. So
Great.
Yeah.
Thank you again.
Thanks for coming.
Yeah.
Not thanks for coming. Thank you for having me.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.